In today's episode, we had the opportunity to learn from Dr. Chris Clemow. He is both a primary care physician and a sports medicine doctor. So he has spent many years dealing with injuries and trying to prevent injuries, and has experienced the impact of the opioid crisis with both individuals, families, and the community. So I invite you to listen carefully as he explains how we got here as a country, the responsibility of proper pain management, the alternatives to pain management other than opioids. We're going to also hear about the vulnerabilities of the youth population, and the best news is that there is hope. Dr. Clemow, thank you so much for being here today. I've had the opportunity to work with you indirectly through the PlaySafe USA program for a couple of years.
Right.
But now I want to put on my podcast hat and interview you and just pick your brain as a physician. You're both a primary care physician and sports medicine doctor. So
that's right. Yep.
Naturally, you've had plenty of experience with patients, managing injury and making sure that everybody is well taken care of. I think you have a really great perspective in that you're not just a doctor, but you also are the founder or a founder of PlaySmart. So you've also spent a ton of time with student athletes and making sure that they are being preventative with injury and also that they make good decisions after the fact. I want to just get straight to the beginning and get straight to the point and ask the question from both perspectives. How did we get here? From a country that went from trying to tend to pain management to an opioid crisis.
Right. I think, well, first of all, thanks for having me, Alison. I very much appreciate the opportunity just to talk about these things. And I think as far as how we got here with regard to opioids and controlled substances and abuse and those types of things, it's a very long story, complicated story. From a medicine standpoint, we're very much aware that, 15, 20 years ago, that we were very much had our mind's eye on making sure that pain was very well controlled. We called it the fifth vital sign at the time. Mm-hmm. And it was sort of expected that if we were taking good care of people, that those people really didn't have any pain. And we probably never should have expected people to not have any pain in life. To have some controllable and reasonable amount of pain was probably okay. But we, at the time, didn't really realize how much dependence issues we would create. We didn't know how many people would end up taking these medications inappropriately or becoming dependent on them, or worse things like even overdosing on them. So we figured out that years ago that we were headed down the wrong path, and we tried to figure out, well, how do we reel that back in? And a lot of people have been involved in politics and in medicine and so on and so forth in the process of trying to help us be healthier and safer as a country, and student athletes with regard to what we do with PlaySafe and PlaySmart to be safer and healthier. We've done things like make sure that we prescribe as least we need to. Right. We prescribe and monitor things very carefully now. We have electronic monitoring systems that basically, I know as a physician, every time somebody's had a controlled substance prescribed to them and things like that. And we've educated people a lot better about the risk of things like narcotics and controlled substances of all types. And people become more aware. Certainly people have been touched by these things in their families. They've had people that became dependent on controlled substances. They've had people even die of things like overdoses. And we've learned as a society that we've got to do better. We've got to figure out a way to make sure that we head in a better direction, that we protect people from things that negatively affect them in their life, like opioid dependence.
Yeah. So there is sometimes, because one of the questions we always get is, if they're so dangerous and they create this problem of addiction, why do we even prescribe them at all? Yeah. And so we know there are situations where there is legitimate medical use for opioids, but it always comes with a risk.
Right.
So with that, those are when you talk about, you have to better educate your patients. And so what are some ways, and I know that you talked about a few, but
I think you bring up a good question. I remember asking one of the pain management doctors that I had a good relationship with as a friend coming through my career. I asked him one time, I said, would we have actually been better off as a society if we never even discovered opioids?
Right.
And that's a complicated answer. I think that obviously none of us want to experience pain of any type, certainly physical pain we don't want to experience. So there are examples of pain that's quite severe, and we want to be able to control that. We want to make sure that we do our best to keep people from having misery, but we do now especially have other things that we could use besides opioids. There's new drugs being developed all the time that may have less issues, that may have less risk.
Yeah. I want to talk about those alternatives, but before we get into the alternatives, even when people have legitimate medical use reasons for an opioid, it's always a trade-off.
Right,
They may have a better quality of life in terms of pain, but there's the reduction on the other side because of.
Exactly. I explain to people that, especially if you set down the road of taking narcotic pain medicines for a prolonged period of time, that you're reducing your peak potential quality of life. You may be better off on some level because you're not experiencing whatever pain that you're talking about. But you are compromising something and you are creating risk for yourself. And we try to help people understand that as best we can. And we try to encourage people to look at other routes, to not go there, so to speak.
And sometimes it's temporary. So meaning that after a surgery or a situation that's not long term, they may need it for a certain amount of days.
That's right. Yeah. Many times most of the time it's temporary. And we still have concerns even with temporary use because there's so many people that once they're exposed to controlled substances, whatever good feeling they get from it, that they go looking for that feeling again and they become more dependent on it. A lot of people don't have that. Probably 2/3 of people at least don't have that want to go back to do that. I mean, a lot of the patients that I prescribe pain medications for, they don't want them, or they want off of them as fast as they can possibly be, or they don't like the way they make them feel. But for some people, that's not the way it goes.
Opposite.
Not the way it goes. Yeah.
And they maybe aren't as educated as the ones that are saying, don't give me this because I've seen and heard the damage that it can do.
Some of them, they don't know. Some of them, they do know. We do our best to kind of watch out for the people who already have those tendencies. And we call it seeking behavior, where people are trying to get us to write a prescription for narcotics. And we try to avoid those. We try to make sure that we look for alternatives for them and we communicate with them. But yeah, there's good places and bad places.
Yeah, and you mentioned there are alternatives. So it doesn't always have to be an opioid to treat pain. What are some of those examples of therapies that people can use?
Well, I think that people very much underestimate how good things like over-the-counter medicines like Tylenol or ibuprofen or Aleve can be. When I talk to patients about Tylenol, for example, they tell me, well, I took one extra strength Tylenol yesterday and it didn't work. Well, that's 500 milligrams of acetaminophen, and a full dose of acetaminophen is 1,000 milligrams of acetaminophen. And taking it regularly, you take it 3 times a day. And you're not going to do that forever, but you can actually fairly safely. And as long as you have a normal liver, you can do doses of Tylenol like that. So people kind of, for whatever reason, they have fear of those medications. They hear about people overdosing on Tylenol and knocking out their liver or something like that, which can happen, but it doesn't happen if you take them correctly. And same with ibuprofen. I have people that tell me, well, I took 200 milligrams of ibuprofen twice a day, and I look at them like, and you expected what? That's not enough to really control pain. When we prescribe ibuprofen 800 milligrams 3 times a day. Yeah. So people can take 1,000 milligrams of Tylenol 3 times a day and then alternate every 3 hours 800 milligram ibuprofen, as long as they don't have other contraindications. And that is a very powerful pain control in and of itself. So a lot of people with postoperative, post-procedural pain, post-injury pain, they can do just fine on those things. We also have topical pain medicines, things like lidocaine topically, and we have Voltaren gel or diclofenac gel, which is a topical anti-inflammatory that stays pretty much where you put it. And that works better than people think if they use it as they should use it. Yeah. So I spend a lot of time educating people on some of these other options.
And these don't create dependencies. There's
They
no
don't.
addictive nature to them.
They really don't.
And they're over the counter, so
Right.
it's safe, it's regulated.
Yep.
One of the things that we talk about often in Play Smart when we're educating student athletes is we are concerned with you overdosing on a prescription. But
Sure.
more so than that, what we are concerned with is that you get dependent on this
Yeah.
opioid and then you don't have access to it because it's a controlled substance. So you go to the streets to get it,
Yeah.
and then you
Or your
are in a
grandmother's
whole different
cabinet
world.
or somewhere else in the house or
Right.
something like that.
Because
right.
of the likelihood of fentanyl. And
Yeah, fentanyl is a big problem, particularly with street drugs right now. There's way too much existence of fentanyl in the illegal trade, and it's in things that it shouldn't be in, and things like that. And that's where a lot of our young people deaths come from, is they're sourcing what they think is something else, and they get exposed to even a small dose of fentanyl, for example, and that's all it takes before they're potentially even dead, which we can never see. We just can't have that happen.
because just one fake pill can kill.
Absolutely.
And it often does.
Absolutely.
And fentanyl is not just found in counterfeit opioids, but as you mentioned, in other substances as well. So we find it in counterfeit Xanax, counterfeit Adderall, and other.
Yeah, with fentanyl, it's almost always, if we're talking about deaths related to it, it's by far, it's most commonly associated with illegal procurement of that. It's coming from somewhere. We don't prescribe fentanyl. That's not, it's something that's used in operative rooms and things like that. It's not something we give people regularly. There are examples of that, but it's not something that's commonly prescribed, especially not in my world of taking care of injuries and things like that.
Right.
We're using other things. So they're getting it somewhere they shouldn't be, and that's not a controlled world, and no telling what's in it and things like that. And boy, do we have to keep our young people very aware of that.
Yes. And so speaking of young people and the vulnerability of young people, what are some reasons that you've seen through both your medical practice and through your involvement with PlaySafe through the athletic training network that make young people so vulnerable?
Yeah. Well, young people don't quite understand. They're not as aware of risks that adults are, that people with more maturity are. They many times their brain's still developing and things like that. They probably are more susceptible to long-term habits and long-term dependence than adults are. Certainly, certain populations are. So, I specifically worry about the young people. Specifically worry about young people, and they're going through a part of their life that they are very much defining their trajectory in life, where they're headed. Are they going to finish their education? Are they going to go on to college? Are they going to get some training in whatever they want to do? And if something comes along to basically steer them off course, then that negatively affects them for the rest of their life. Rest of their life.
They can be derailed in one bad decision.
Exactly. One bad decision is all it takes sometimes.
So some interesting statistics that I found very interesting as we started this work is to learn about the number of addictions that begin in the teenage years. And so nationally, the number is reported 90% of all addictions begin in the teenage years. And I think that is significant when we look at the landscape of addiction across America. If we can just get in front of these young people and share with them this information,
keep them on the right path.
Keep them on the right path. There's lots of decisions in daily life that don't involve substance misuse, but one of the greatest ones that's going to impact their life is if they do choose to misuse or abuse a substance.
Yeah. I think that's probably true. There may be a lot of reasons for that, as far as why you may be particularly likely to set off on that path at that particular time. Maybe they were already had that type of brain chemistry, that they had addictive potential in general. Maybe it's their socioeconomic situation or their family situation or what they're exposed to. Their developing brains are just not quite ready to make life-altering decisions and things like that. They don't have the insight to understand the risks. I think that's why it's very important that we're looking at our young people to try to keep them out of trouble, keep them on the right path.
To keep them educated, right?
Yeah.
Because one of the things that I really struggle with and that I've learned so much about, and I try to change perspectives everywhere I go, is that oftentimes, yes, there are choices involved, but as it relates to dependency on opioids and substance misuse, sometimes that's not a choice. Sometimes it's the result of an environment or an ecosystem that we've created with lack of education, explaining the risk, explaining the dangers of counterfeit and fentanyl being included in counterfeit drugs. We know that 69% of youth are less likely to take a counterfeit drug if warned about fentanyl.
Yeah.
So how important is this work? And I'm just appreciative to you because I know that you didn't set out in 2011 to create PlaySafe for the purpose of educating and bringing awareness around the opioid crisis. But it's funny how things work. And so how important is this work to the greater society?
Yeah, I think it's critically important. PlaySafe started out just doing athletic trainers. Well, athletic trainers are medical professionals, and there happen to be medical professionals that are around young people, student athletes, and other students, and they are, uniquely positioned. They know them very well. They recognize their normal behavior. They recognize their aberrant behavior, whatever it may be. So we knew that PlaySafe and all of our staff and our personnel was uniquely positioned to be able to move the needle, so to speak, be able to protect these student athletes in a unique and particular way. So I'm excited about what we may be able to do and are doing now. I think we will end up saving significant lives, and probably even more significant and harder to figure out is how you change those trajectories that we talk about, how you keep people out of starting something that's going to become a habit and eventually a dependence and eventually an overdose risk, or et cetera. Hopefully we are in the right position as PlaySafe and the Place BARDA initiative to make the difference that has to be made. And it certainly looks to me that we are.
Yep. And as we, peeked at the crisis of opioids, we around in every community saw young people dying left and right. Just one pill. Some of them who had taken or had the dependency had become addiction. And of course, it wasn't just one pill. There was evidence of an addiction, but many that you never even saw it coming.
Exactly.
And the only way, I believe, just with anything else, like any other public health crisis, to get in front of it is through education.
Yeah, I agree. Yeah, I think that fortunately, over the last 2 years, we have seen some of these numbers going down.
Yes.
And it certainly appears that it's because of education more than anything else. People realizing, wait a minute, I have to be super careful about the decision to take something that I shouldn't, the decision to take something I don't know where it came from or what it might have in it, things like that. And also, unfortunately, a lot of our young people have been somehow touched by this. They've watched somebody die or otherwise have some horrible negative experience, and they know, and they're being told by enough of us that are in adult and public health type situations that they've got to hopefully avoid those things.
Yeah. An ounce of prevention is worth a pound of cure.
Yeah.
It's one of my favorite sayings, and I think that can be true with anything. And those personal stories are helping with the message of prevention. And so I know that as a doctor, you can't share specifics, but are there any personal stories in your practice that may have happened that you felt like could have been prevented, not anything that you were directly involved in, but just in general?
I see patients on a regular basis, quite regular basis, that have negative impact on their life from substances, illegal substances, controlled substances. Every time I think of or do write a prescription for anything, it's in the back of my mind of what might this create for them.
Right.
And as such, I don't do it a whole lot. And, I think a lot of physicians feel that way.
Yeah.
We try really hard to not start people down those lines. I am, indirectly aware of deaths that have happened and things like that. And it hasn't touched me as closely as it has some, as far as just having somebody I had a close relationship with, or a patient that I had a close relationship have an overdose death. But I have colleagues who are very aware of that and have been directly touched by it. So it's out there, and it's way too much.
Mm-hmm.
Yeah.
And there's support systems now in place. And so from a physician standpoint, how is it different today in how you address your patient versus in 2011? When did you get started?
2011 was when we started. That's when we started PlaySafe. I actually started as a physician in 2003.
Okay.
But I think the things that are the biggest differences that I deal with every day, we've been mindful of this for a long time, as far as just trying to be careful with narcotics and other controlled substances. But we have systems in place like prescription monitoring systems that are electronically monitoring all the filled prescriptions and things like that. I really am kind of mindful of my young people being exposed to any controlled substance, and just the chance of them becoming dependent upon that, or having, I know a certain percentage of them are going to have, they're going to effectively get high from it and things like that, and they're going to want to go back for that feeling. So probably they don't need to ever touch it to begin with. So we need to, as physicians, try to make sure that we limit it as much as possible. And going back to your point earlier, maybe we've got to get away from opioids being a thing that we use to control pain completely, at least on the outpatient basis, that type of thing. We may get there.
Is that that's a
possibility?
possibility?
I think so. I mean, we have a new drug now called Jernavix, which is a completely different method of controlling pain. It's still very expensive because of the way the United States healthcare system works right now, but it's an example of a drug that it has been controlling people's pain pretty darn well. I mean, in the past, when we thought we really had to control pain, that one of our only ways to do it at a high level when pain was bad was opioids. But it looks like we may be at a point where we're developing some alternatives, and I hope in another 5 or 10 years that we don't need them very often. We don't need the high-risk controlled substances anymore.
Yeah, another thing, speaking of opioids and prescription, is that I was really surprised by is that in the state of South Carolina, 9.6 million prescriptions every year, and 5 million of them are opioids. So out of every prescription prescribed, and that's South Carolina, that's not national.
Yeah, well, I've seen similar numbers. I couldn't quote the exact numbers that you are, but I mean, those numbers don't shock me. Okay. That's for sure. There's a lot of people right now that have dependencies on opioid pain medications for chronic pain of various degrees and other things, and it's very difficult to get them off. It's quite an arduous process to get them off. It requires lots of different professionals and lots of different avenues and facets that you've got to try to work through. We do have programs like we call medication-assisted therapy, which basically we have medicines that help deal with some of the feelings and dependence-type symptoms that people get when they stop these medicines, and they're effective. So we have programs that work, fortunately. But it is, I'm sure, shocking to normal people that aren't in medicine all the time, just how many people are taking something for pain.
Right.
And it goes back to just the idea that that many people feel that they shouldn't have any significant pain in their life, whereas we all kind of experience it to some degree. And that we got to figure out a different way to tackle the problem.
So it would be great, and the possibility is there for this new medication that you just mentioned. If we were to say, hey, there's 9.6 million prescriptions every year, and now we're down to 3 million that are opioids, and we've replaced that with this other drug that doesn't create addiction. I think that would be fantastic, because what we like to tell the student athletes is, hey, we use that as to say, if you go to the doctor, the likelihood of anybody once you get a prescription is 50% that you're going to have an opioid. So therefore, be educated. Don't be fearful. Do as the doctor orders, but understand that there are high risk involved and that ultimately we are responsible for our own health.
Right.
And make decisions accordingly.
Yeah.
And that's true for not just the individual and the student athlete. I know that we focus heavily on student athletes, but we're also here to educate parents
All young people
and families
and parents on
and
how to
all
educate
young
them.
people. That's right.
Yeah.
And the community at large.
Right.
The more people that know, the more people are responsible. So, I think there's hope, and I'm happy to hear that.
Yeah. There's definite hope. We say, I mean, we mentioned things like numbers going down as far as overdose deaths and things like that, and fentanyl related problems going down, which is a complex thing, and a lot of people have different theories about why that's going on. All the systems that we talk about are making a difference. We just have to keep moving in the right direction. Yeah.
What is something that you personally, if you were standing in front of, we'll put you in front of student athletes first, and then we're going to put you in front of the entire South Carolina community, and what would you think would be a nugget of information that could help solve this problem?
Well, with student athletes, I think as we talk about this particular problem, I talk a lot with young people about making good decisions. And I try to expound upon that in the sense that I'm trying to let them know that there's so many important decisions that they make all the time. It can be about what they choose to do for a living. It can be about whether or not they finish their homework or not. It can be about whether or not they prepare for a test. But it also can be about whether they take a medication or they drink alcohol or drink too much, all those things. And some of those decisions will impact them forever. And it's incredibly difficult for them to understand that at that particular time in life. I think any of us that we look back at that time of our life, we can realize that we wouldn't really been good at making those decisions. But I do think it makes a difference if doctors, if adults that care about them tell them all the time, please understand that this is an important time of your life, that you've got to make good decisions. As far as the ones that I take care of that have had injuries and things like that, and they may be exposed to pain medications and stuff like that, I tell them that it's very difficult for student athletes to go through an injury. And they have to use that drive that they have about being a good athlete to being a good patient, to being engaged in their physical therapy, engaged in the process, but also to constantly remember you're going to get to the backside of this. You're gonna get past it. You're going to be back to what you were doing. We'll help you along the way. And if it comes up that we're using pain medications as far as narcotics and controlled substances, I'm going to have a conversation with them about this is something we're going to use for a very short period of time. It is something that, you got to concern yourself with the risks and things like that. I'm concerning myself with the risk. You need to do the same thing. And we're going to stop this pretty soon. We're going to be moving away from this, and we're going to be moving on to other ways to get you beyond this, get past this, past the pain, past the impairment, whatever it is. So that's what I would tell student athletes and young people. As far as just adults and everyone, I would say just don't keep your head in the sand. Pay attention to the fact that we got problems that we've got to address. Remember that the adults in the room have got to be the adults in the room and try to lead and do the right thing when the right thing comes along. Support the efforts that other people are making that are making a difference, those types of things. That's kind of what I tell politicians, I guess, is, please help us help this problem, right?
Yeah.
And fortunately, in the state of South Carolina, they have been doing that. So that's great.
Good.
Yeah, especially with PlaySafe, Play Smarts program.
Yeah. It's been such a pleasure to be a part of the Play Smart program. I'm not sure what drives my passion for it, but for most of my life, I've been passionate about substance or preventing substance misuse and abuse. And so being a part of it is an honor. And so I believe that you're a part of that by forming the organization that has grown into this. So I thank you for that.
Yeah, I think, I think my drive is just as it pertains to people's wellness, their quality of life. I feel that way about what I'm taking care of with their injuries or what I'm taking care of with their illnesses. But this is a much bigger impact. I mean, when you talk about substance abuse and dependence issues and things like that, that is a lifelong, day-to-day,
Yes.
monstrous impact on them. So I know that if we can make a difference in this arena, that we are making a huge difference as far as the wellness for the people that we take care of when they're young, and as they grow old, they become adults and have their own life. So
yeah. Speaking of to what you just talked about, the externalities of opioid misuse or any substance misuse, and then thinking about it in terms of how it is a burden not just on the individual, which is what has brought us into this public health crisis, that it is a shared burden to the family, to the community, to the workforce, to the
doctors
healthcare
prescribing
system.
it,
The whole
to the grandmothers who need to lock up their pain medications, or a lot of houses have narcotics in them because somebody had a surgery a few years ago or something. So there's there's a lot of responsibilities that we've got to take. Yeah.
And to just wrap that all up, the idea of this being a market public health failure versus a moral failure, I think is something that the whole country needs to hear, so that we can stop looking at people with addictions as if they've made a bad moral decision, because oftentimes it's not, and treat it like the market public failure that we're actually in.
Yeah, I would say they have a wellness issue. And it's not any fault of theirs usually. The wellness issue that they have has been brought upon them by many different factors. Many people have responsibility. I think many people have to take responsibility and make sure we fix it.
Yes. Very good. Well, I appreciate you being here today. What else? Is there anything I've missed that you wish that I would ask you, or that you came prepared to say?
I think you did a wonderful job.
Okay. Well, thank you for being here, and I'm looking forward to continuing the work with Play Smart.
Yeah. Thank you very much. Thank you for your time.
Thank you.